At Holland Hospital, we believe everyone should have access to quality health care, which was why we extend our care to the community beyond the hospital walls. For over 25 years, we've funded community outreach programs that bring care directly to those who need it most, fulfilling our mission of continually improving the health of the communities we serve in the spirit of hope, compassion, respect, and dignity. We accomplish this by providing school nurses and mental health support in our local school districts, by covering breast care services for uninsured women, and by offering affordable primary care to underinsured and uninsured community members. Let's hear some of those stories now.
The Holland Community Health Center is a full lifespan primary care family practice. We see infants through adulthood, and we currently serve about 4,600 patients.
We are a place that they can send someone if they are having trouble with having insurance, having trouble finding a place that accepts their insurance. We want to work with people and get people the care they need.
I'm very proud with the relationships that I build with patients because I feel as if we are able to make an impact in their lives. I have patients where I see grandma, I see aunt, or I see kid, and to be able to give that family care and to offer them advice is where I feel like I really give back to patients in the community.
I really think it's just important for the community to know how much of a collaboration and a whole, serving the whole person kind of model we offer. People are coming in for their medical appointment, but they might end up leaving after having talked to Megan about some type of resources or talking to myself.
We know our patient population and we know the barriers that they face, so we try and have a lot of education and resources for them about how they can get past some of those. There are resources in the community, there are medication assistance programs, there are resources, so sometimes it's just trying to connect the dots for patients and be there for them as well as we can.
Dr. Duncan helped me with all the things I needed to know and all the things I needed to prepare as a mother. So that was nice.
We are high touch and constant communication with our patients, and we want to make sure that access to care is easy, affordable, and it's life-saving.
When I'm sick, she helps me get better. I would come down here, she'll give me like a glass of water, and then I would go to the front desk and she'll give me medicine.
Having a school nurse, I think, really helps to make an impact on keeping kids in school where they can, get their education where we want them to be. It doesn't affect their family where their parent has to call off work because their student is calling home to be picked up. So the nurse is able to make that call from a medical perspective to just really make sure that that student is healthy and able to learn.
When we have situations where students don't feel well, or maybe an accident, we have somebody who's trained on site who can kind of give us an immediate diagnosis.
In case of emergencies, she can come and help, and it just makes me feel way better. I'm not doing it on my own.
When students come to see Lindsay for a medicine administration or some kind of regular checkup, she's been able to develop a relationship with a lot of those kids that sometimes they may not necessarily feel comfortable talking about with other staff members. So she truly is kind of a full member of our staff, she's fulfilling these dual roles.
I often get the question, what does a school nurse do? And I would say the things that we do the most are we deal with the chronic health conditions of the students and sometimes the staff that we see in our buildings. We often hear, well, all you do are Band-Aids and ice packs. I would say that's probably the least of what we do. We train staff to function in the buildings when we aren't present because we aren't there all day, every day. We train staff how to respond to emergency situations. We train staff on how to safely care and treat our students in our absence, in a nutshell. So within our program, we also have the benefit of a community health worker, and in our case, she's bilingual. She's been with our program way before I got started. So she understands how the schools function, the students and the families, and all the community resources, and is able to connect those students and their families with those resources. We also have a school mental health program, and within that program, we have a mental health care manager, and her role is really to be that connection. She's that true liaison between provider, between inpatient, outpatient services, the schools, and the family. She's that one person that they can contact for those highest needs kids who have severe mental health issues and need some connection and need safe and support plans in school, and that the school is able to support them in the manner that the physician or the provider had intended.
The goal of this program is to walk alongside these families and with their student and their children during crisis situation. Someone that understands the school environment and the medical field.
That's where I come in and I just walk along with that family and that student. I help them understand the process for getting mental health care, what resources are available out there, and then I also make them realize the follow-through. My feedback from families is that there's this huge relief knowing that someone at school is available and knowledgeable to help them during what's really a difficult time for the whole family, in supporting them and helping that family and that student get the help they need, and then someone there to transition. That's the key to the role, is that transition that comes back to school.
This is the number one issue facing our kids right now coming into school is mental health. When Holland Hospital reached out about the mental health care case manager position and what this could mean, I think this is a game changer for our families. And what we've seen is a drastic decrease in students who are coming with, self-harm thoughts or even actions, and that parents they're reaching out and talking to me about just how supportive they felt through this. What I see and what I know that is going to happen is this is going to have a generational impact down the road, where the kids that we're seeing right now who have been struggling with it, their kids aren't going to, because of the investment we're making in them right now. This supports that we've been putting in place in partnership with Holland Hospital is saving lives. I can say that with 100% certainty.
Some women avoid coming in for their mammogram because of the cost or lack of insurance coverage. And at Holland Hospital, to help with that, we've established the Breast Care Fund.
The Breast Care Fund helps pay for screening and diagnostic mammograms, ultrasound, MRIs, biopsies. It pays for the imaging fees, that it pays for the radiologist to read the images, the pathologist to process any biopsy specimens. So it really encompasses a lot, and it just allows women to get the care they need and deserve. And we're able to catch early breast cancers.
Because we do see what happens when a breast cancer is left to grow and, does not get addressed because a patient is worried about pain or that kind of thing. So I'm really proud of the fact that we're able to offer that.